Alright guys, this video is on hearing loss. You might get that on the CS exam. There's even a case on first aid about the hearing loss. So when you're taking the exam, you're standing in front of the door, and when you open the doorway, if you see a patient with hearing loss in the doorway information, just write down this mnemonic. So it's P-A POM COPD. So mnemonic to remember all the causes of hearing loss. So POM COPD, the P is perilymphatic fistula, and to be honest, you'll probably never see it on the CS exam, so don't even bother about this one, but we'll just keep the P for the sake of the mnemonic. So A is acoustic neuroma. Another name is vestibular schwannoma. So it's an intracranial tumor. Intracranial tumor. Let me erase this. So it's an intracranial tumor. So the patient would have headache, vomiting, or morning headaches, vomiting, tinnitus. They would have balance, vertigo issues, and an important one is facial weakness or paralysis. Pretty serious. So let's move on to the L. L is labyrinthitis. The only one for this one is people with this had a recent upper respiratory tract infection. So when you're doing the history, when you go to the PAM hits FOSS mnemonic that a lot of people use for the past medical history, you can ask the patient, have you had any recent illnesses, infections? If they say yeah, a couple weeks ago, so that will help you with this differential. You can use that. So M is Meniere. This one, the patient will have fullness, tinnitus, which is the ringing in the ears, vertigo. Vertigo and balance are two different things. Balance is when you're feeling like you're gonna fall, well, you just lose your balance. But vertigo is when you feel like the room around you is spinning, not you per se. So Meniere's, they also history of syphilis. So when you're doing the history of the PAM hits FOSS, you can ask them, have you ever had any STDs in the past, like syphilis? If they say yes, that'll help you clue in on Meniere's. So for the URI and the syphilis, I would ask in the past medical history, but when you're trying to ask about the hearing loss, you can ask about the headache, vomiting, tinnitus, balance. Yeah, they overlap. So in the past history, if they had a recent upper respiratory infection, is this. Syphilis, history of syphilis is this. Alright, let's move on to the other part of the mnemonic. We did the PALM. Let's do the COPD one. So the C is cochlear nerve damage. So when you're asking the history, you can ask the patient, have you been around any loud noises recently or throughout your life? Loud noises. So army is a common one. They'll say I've been in the army, so they've been exposed to loud noises. People also can be frequenting concerts where it's loud, or they may be like a construction worker. So you'll get some good clues in the history for cochlear nerve damage. So O is otosclerosis. This one is has a very specific one. They have trouble with whispers. So you can ask them, are you having trouble when people are whispering to you? That's the only thing I have for that. But when you do the physical, when you do the Rhine and Weber test, Rhine specifically, these patients, the bone conduction is greater than air conduction for the Rhine test. For any patient with hearing loss, do the Rhine and Weber test, and if the bone is greater than AC, that's going to support you with the otosclerosis. For P is presbycusis. So these patients, old age, that's one. They have a history of hypertension and diabetes, history of smoking. So when you do the doorway information, if you see like a, 72-year-old male, I would think about this, I would keep this in mind. And when you're doing the past medical history, if they say they had any of these, that's going to support this very much. And finally is the D for drugs. So technically it's ototoxicity, drug toxicity. Drugs such as furosemide, aminoglycosides like gentamicin. So in the past medical history, you ask them, are you currently on any medications or ever before? If they mention any of these, that's going to help you with the ototoxicity. So with the mnemonic, we have PALM-COPD, but the fistula, like I said, you're never going to see it. So you have 7 differentials. So acoustic neuroma, the one that pops out is the headache and the vomiting. Labyrinthitis is upper respiratory tract infection. Meniere's syphilis is one that pops out. Cochlear nerve damage, the loud noises. You can ask them about their occupation. Otosclerosis is the whispers, and BC is greater than AC. That's the only abnormal physical you will find. Presbycusis, old age, and ototoxicity is these. So for the differential, you would put drug-induced hearing loss or just ototoxicity. So that's hearing loss on the USMLE CS.